Whoa.
We know cardiac cycle has two phases. One is the systole, the other one is the diastole. And the total duration of cardiac cycle is 0.8 seconds. And the systole can happen both in the atrium as well as the ventricle. Duration of systole in the ventricle will be more. Okay. First of all, the systole will have around 0.3. Among this 0.5 seconds. Diastole will be around approximately 0.5 seconds and the systole will be 0.3 seconds. This is the approximately. In this 0.3, most of it will be ventricular systole, 0.27 seconds, and atrium might be 0.1. Diastole, ventricular diastole will be 0.53 seconds. And the atrial diastole can be around 0.7 seconds. So coming to the proper things which happen in the cardiac cycle, we'll see everything separately and then make a graph out of it. We have the atrial systole. It is the atrial contraction which happens because of the impulse generated from the SA node, and during this atrial systole only you have the P wave in the ECG that is formed, and it accounts for about 40% of the ventricular filling. After the atrial systole, once the blood goes inside the ventricles, then you have the ventricular systole. Ventricular systole nearly starts near the end of the R wave in ECG and ends at the end of T wave. The ventricles usually contract when the pressure exceeds the atrial pressure, and hence you will have the opening of the aortic valve or the pulmonary valve and the blood goes out. And this ventricular systole proper has two phases. One is the rapid ejection phase, which is around 0.1 second, where the intraventricular pressure is very maximum, going to the maximum level, and it increases the ventricular output, and almost 2/3 of the stroke volume will be ejected during this rapid ejection phase. The second phase will be the slow ejection phase. The slow ejection phase will be ventricular contraction subsides and the pressure usually decreases during this time. Once the ventricular systole is attained, then obviously the ventricle has to dilate, diastole has to happen. Ventricular filling happens. Ventricular diastole. Ventricular diastole basically has it lasts for around 0.5 seconds. Ventricular diastole also has different parts. One is the protodiastole, where the ventricular pressure drops rapidly and there is a closure of semilunar valves, which in turn causes the second heart sound. Next you have the isometric relaxation. Here the initial part of the ventricular diastole, the intraventricular pressure usually drops and the ventricular muscles continues to relax without any change in the intraventricular volume. No volume change, but pressure drops. Next comes the ventricular diastole proper. Here it is nothing but the passive filling of ventricles. Around 70% there is a passive filling of the ventricles. Even in this ventricular diastole proper, you have the initial rapid filling phase and then the slow filling phase. Once this is done, the one which simultaneously happens is nothing but the atrial diastole. The atrial muscle relaxes and the pressure gradually increases due to the venous return. Now when you make all these things into a graph, how will it be? For that you need an x-axis and a y-axis. In a graph, y-axis will be the left ventricular pressure, intraventricular pressure in FMGE, whereas the x-axis will be the left ventricular volume, which will be of course in the ml form. Okay. You can keep measurements like this. So when will the volume increase? The volume will increase in the ventricular volume will increase in the diastole, right? So we'll keep a point here, and from here the volume is increasing in a diastole, ventricle is getting filled up and it has increased to a limit. Okay, so now the ventricle is all filled up. When the ventricle is all filled up, what will happen? It has to contract. Ventricular contraction, it happens in two forms, two separate parts. One is the isovolumetric contraction happens, and then only there will be a rapid ejection that happens. So now I want the pressure to be increased inside the ventricle so that it can overcome the aortic valve pressure and open up the aorta. Now, without any change in the volume, there is an increase in the pressure. And now it has changed, an increase in pressure has happened. What will happen once the pressure has increased with no change in volume? Then it becomes the isovolumetric contraction which got over. Now the pressure is high enough to open the aortic valve. Once the aortic valve is opened, what will happen? There will be a rapid ejection phase where the blood just goes inside the aorta. At one point when the pressure all drops, the aortic valve closes. So now the pressure is high inside the ventricle, the aortic, but nothing, blood has all gone out, nothing is inside. Now in order to refill, it has to reduce the pressure. And now the ventricles are slowly relaxing without any change in the volume to get back to the volume form. This is nothing, this is called as the isovolumetric relaxation. This is the isovolumetric relaxation. What will happen once it's totally relaxed? It has to receive blood from the left atrium. From left atrium to the right atrium, what valve is there? It is nothing but the mitral valve. So the mitral valve has to open for the blood to come inside the ventricle. Once the blood is inside the ventricle, the mitral valve closes. And the pressure is built up again. Once the pressure is built up, aortic valve opens and blood goes out inside the aorta, and after that, because of pressure drop and the ejection fraction, once it is over, the aortic valve closes and there has to be a relaxation of the ventricle, and the cycle just goes continuously like this. Okay, this is one of the important figures of the cardiac cycle. we have to know about the phases of cardiac cycle and what will be the respective ECG events and the JVP.
A great success!